So medial elbow pain is a common diagnosis that we'll see in a lot of our overhead athletes, and that's a good amount of the caseload that I typically will see in the clinic. So I want to go over a couple of the diagnosis tips and tricks and evaluation tips that I have for diagnosing someone's medial elbow pain, really throughout the spectrum of players and athletes, from the youth athlete all the way through the professional athlete. So I think number one, out of the most important part, is actually having a really good sound understanding of the medial elbow anatomy. So if you think about the medial elbow, similar to other body parts and joints, I'll usually think about the inside out. So you've got the bone, and you got the humerus, and then the ulna coming down the medial side. On top of that, you've got the joint and then the ligaments. Right, so you've got your UCL that's coursing from the media epicondyle down to the sublime tubercle of the ulna. And then on top of that, you have your flexor pronators, and you have your ulnar nerve sitting in the ulnar groove or the cubital tunnel behind the elbow. So all the structures that need to be evaluated and assessed. So for me, if I've got a youth athlete that comes in with medial elbow pain, and we'll start with the youth and we'll work up the age span. So youth athletes, first thing on my mind is growth plate, right? So with these youth athletes, typically the growth plate's going to be open. And with open growth plates, the ligament, so the UCL is going to attach on the medial epicondyle. And as you're putting more stress through that medial elbow with the active throwing and getting your arm all the way back to max external rotation, you're going to start to put tension on the ligament, which is going to put tension on the medial epicondyle. And because that growth plate is not fused yet, you're going to start to pull that medial epicondyle away from the humerus, which could lead to inflammation. And then over time, you can actually pull it away from the bone, which may lead to some more severe problems. So in the youth athlete, typically it's this medial epicondyle apophysitis, they call it, which essentially is little league elbow as most people know it. And that's inflammation around the growth plate. If it is bad enough, you can pull that whole growth plate off, and that might require fixation. They call it ORIF, where they go in and they put a screw, and they'll put that medial epicondyle and screw it back down to the humerus, which is obviously less than ideal. But if not caught early, and that's something that people work through and continue to throw through, that can definitely lead to needing that type of surgery and that open or the medial epicondyle ORIF. So from the youth, and then again with the youth, unfortunately, you cannot rule out a ligament injury. Obviously, it's more common to have an injury at the bone because the growth plates are open, but we have seen some isolated cases of isolated UCL injury in the youth athlete, which is definitely more rare, but it does happen. So your suspicion should be relatively high for those as well, and you want to rule those out. As you progress the age span, so as you go up to high school collegiate athletes, and these players come in now with medial elbow pain, you might be thinking about a couple other things. So as the athlete continues to progress in size and training increases and intensity or velocity starts to increase, now we see some more of these injuries at the actual ligament itself. So once that growth plate's fused, you might start to see true ligament injuries. And ligament injuries are going to span from a simple grade 1, where it's a stretch or a strain of the ligament, all the way up to a ruptured ligament. So medial side of the elbow, again, we're thinking as that arm is in max external rotation, so as they're rotating all the way back and getting ready to accelerate the ball, there's a lot of tension on the medial side. So if they say that there's pain during that max external rotation position, I'm thinking of UCL injury or potential UCL injury. You also have the ulnar nerve that travels right along that medial elbow that can get stretched and irritated, so you can't forget about the ulnar nerve. And then you have your flexor pronator tendons that come on that medial side as well. So those are three things that I'm thinking if the athlete tells me that they have pain during max external rotation. So then the question is, how do we differentiate between the three? So for UCL, what you can do is a moving valgus stress test, which essentially your arm's up in the 90-90 position. So you're maxillary externally rotated, and you're going to flex and extend the elbow through that arc of motion to see if you can reproduce the pain on the medial side of the elbow. There's also the milking maneuver, where the athlete can actually do this themselves also, where their arm is up in a 90-90 position, they grab their thumb with the opposite arm and they pull back into external rotation, which should also create or recreate that medial elbow soreness. On the table, you can also do just a prone medial valgus test or supine with the arm pronated or supinated. Everyone's got their preference, but you want to try and recreate the pain with the valgus stress. If you're thinking nerve, so for me to rule out nerve, you can try Tinel sign, but even more for me is going to be a little palpation. So I'll palpate along the track of the nerve, and usually I'll start proximal, about 3 or 4 inches proximal to the medial epicondyle. I'll track it down around the medial epicondyle, and then I will track it down into the ulna. And with palpation, if that nerve is really irritated, palpation is going to irritate it as well. The nerve is pretty thick nerve, so you can almost run your finger over it. And they might reproduce symptoms into the 4th and 5th digits. The ulnar nerve we've seen cause isolated medial elbow pain as well. So there are cases where inflammation of that nerve can cause isolated medial elbow pain. So you don't want to rule the nerve out, especially if you don't have those radicular or distal symptoms. The nerve can still be part of the issue. And then you have your flexor pronators that sit on top of that. So a little more anterior to that, and you will see that if you palpate the flexor pronator tendon, it's a pretty bulky tendon as it attaches to the medial epicondyle. So you can run your finger over that tendon, and you might actually feel or be able to reproduce the site of that patient's pain. Obviously, we could do a resisted flexion pronation test, which also might elicit the same soreness. Or you could simply have them take three fingers and push their 3 fingers into the forehead, where they're going to then contract those flexor muscles, and that might create soreness. I would say for me, I also like to palpate. So in the medial elbow, there are a lot of structures that are very close. I'll use my left elbow here, very close to that epicondyle. So when I palpate, my thumb's going to be right on the medial epicondyle. If I'm thinking it's a ligament, I will come just distal to that epicondyle, and now I'm on the sublime tubercle. So it's a very tender spot, but I'll come right down distal to the medial epicondyle. If I go just posterior to the medial epicondyle, now you're in that ulnar groove, in that ulnar gutter, or the cubital tunnel. So right there, that's where your nerve lives. So if I palpate just posterior to the epicondyle, now you're on the nerve. And if I palpate anterior to the medial epicondyle, now I'm on the flexor tendon. So again, I'll go just distal to be on the ligament, I'll go posterior to be on the nerve, and I'll go anterior to be on the flexor tendon. There's a lot of structures in that very small space. If you do go a little further back, you'll be on the olecranon, and that's where they'll get some posterior medial soreness. So you also have to pay attention to that posterior medial side of the elbow and the joint by the olecranon, because there are bone spurs that can develop there, and they can cause some posterior medial impingement. So if we take all of these different injuries and you put them into phases of the pitch, so during max external rotation, medial elbow pain during max external rotation, I'm thinking probably ligament first, then nerve, maybe flexor strain, but that would probably be last. If they have pain during extension and ball release on the medial side, then I might be thinking posterior medial bone spur, or also flexor tendon. So as our players release the ball, they're going to flex and pronate that hand during ball release. So you might see some irritation of that flexor tendon during the ball release position. So I think for you, if you're going to evaluate the medial elbow, again, there's a lot of different things that can be causing this pain. So if you are going to evaluate the medial elbow, having a systematic approach and knowing the common types of injuries you might see in some of these players, and then also just being able to categorize, the youth players probably going to be more of a bone issue versus a ligament. Our higher level players probably going to be more of a ligament issue than the bone. And then being able to palpate around the elbow to figure out the exact location of their soreness and of their pain, because that's going to dictate their type of treatment. Usually a lot of these players, especially our higher level ones, will have MRIs if they've got medial elbow pain, so we'll know exactly what we're dealing with. But having a really systematic approach to your evaluation. Again, typically I'll work inside out, so I'll try and rule out bone issues, whether it's posterior medial bone spur or a youth player's apophysitis. And then I'll come up and I'll check the ligament out, and then I'll palpate for flexor tendon and ulnar nerve and see if that creates or recreates any of their issues. So I hope this helps. We'll have plenty more videos about elbow pain and throwers. We're going to cover the lateral side next, but for medial elbow techniques, try some of this stuff out and feel free to leave comments below. Thanks.